I'm Jonathan Bridges, the CIO at Exponential-e, and here at Exponential-e we're always focused on driving new innovations into the market and supporting our customers. But I'm really excited to announce our new focus in digital pathology. It's a great area of innovation that the market's been needing for some time, and the healthcare sector really needs to take advantage of this to drive innovation to their customers and actually advance human progress. One of the key things around digital pathology historically is that you would get a sample taken and then someone would look at it through a microscope, and then it would potentially be put onto a slide and sent in the post or through internal mail, and it could be 2 to 3 days before that hits the right person. They would then have a look at it, analyse it, and then get the results back. And what we're focusing on now is accelerating that process to ensure that people can get real-time results, and that's going to really help to improve patient care and provide better outcomes in the health sector. We've joined an initiative which is NPIC, which is the National Pathology Programme, and we are the core technology platform provider to that. So now what happens is a blood sample is taken, it's immediately put through a specialist scanner device, digitalised, and then sent into our back-end PACS platform, which allows a huge volume of data storage of those images and rapid recall of those for people to consume and look at. But this all happens in real time. What that means is that you can then take those images in and someone could email a link or share access to the platform, and someone could look at that anywhere in the world immediately from the time that that's scanned into the system. To do this, we have deployed a high-performance scalable architecture that ingests over 1.7 million files a year and will probably increase to 3 to 4 million files a year, and stores that multi-petabytes worth of data, allowing those hospitals to be able to rapidly access the information and analyse it. On top of that, what we're focusing on is trying to drive increased levels of AI on those platforms. Obviously the future and the ideal scenario is someone takes a blood sample and that can be analysed against the last 2-3 million blood samples, and use pattern-based recognition and technology such as that to be able to analyse and predict or see quickly the outcomes or historical issues that have been happen to other patients. That could be, for example, cancer, liver failure, all of those pieces. Our focus is to be the platform technology provider to enable that and work with the specialists in the medical world, the research world, to harness that data. One of the key elements of doing this is to have really strong technology partnerships. We have the ability, leveraging our HSCN, which is the healthcare network, to connect multiple hospitals up together and give them high network performance to our data centres. Within our data centres, in partnership with Dell Technologies, deploying high-performance HCI platforms, scalable storage platforms using technologies such as PowerScale and object storage such as ECS to create these huge scalable platforms, but also deliver them sustainably. We don't want to be putting technology in and not driving sustainability in that, so ensuring that we can deliver them in green data centres and look at how we can offset the carbon emissions through those platforms over time. Our focus through the partnership as well is now enhancing that, helping the NPIC programme and wider pathology programmes to advance the digitalisation of platforms into multiple customers and multiple NHS trusts to support them driving their strategy and growth. It's really exciting to see that the government's massively behind enhancing these capabilities. There's lots of funding coming out to support hospitals, and we're here as a strategic partner to deliver those platforms with a time to value of 6 to 8 weeks. Our real focus is about helping to drive that human progress, helping to drive innovation and support the health sector in rapidly advancing the time to deliver outcomes in the pathology sector.